Hello, and thank you for joining us for our webinar, Keeping the Consumer in Focus in 2022, Building a Patient-Centric Strategy During the Pandemic. I'm Adam Rubenfire, a content manager at Phreesia, and I'll be moderating today's presentation. We all know how difficult it has been to focus on long-term strategy amid the ebbs and flows of the pandemic, especially the recent Omicron variant. The pandemic has not only impacted healthcare's leaders' ability to plan, but it has also reshaped what the future of the industry looks like. Today, our speakers will offer an overview of some of the top issues that healthcare leaders should focus on in 2022, based on a survey of over 1,000 patients during the pandemic, and share strategies for aligning with consumer expectations. Our speakers will offer an agenda in just a moment, but I'll take just a brief moment to share some housekeeping notes and introduce them before they get started. Today's webinar, we will have a Q&A session at the end. You can submit questions at any time using the Q&A widget at the top left-hand corner of your screen, and I'll ask as many questions as I have time for. In the resource widget on the left-hand side of your screen, you'll find a one-page overview of Phreesia and our product offerings, and a link to a short explainer video about how Phreesia helps manage staffing challenges. If you have any technical difficulties, please click on the help widget. It's a question mark icon, and it covers common issues that you may find while using the webinar platform. Since it's always one of the most frequently asked questions, this session is being recorded, and we will share a copy of the recorded presentation by the end of the week. Finally, a few quick words about Phreesia. Phreesia is the nation's leader in patient intake, and we're guided by our overarching mission of creating a better, more engaging experience for patients, providers, and staff. Our innovative platform enables our clients to improve efficiency, enhance clinical care, and give patients the convenient, flexible experience they prefer. We're proud to have been named the top-ranked patient intake solution by KLAS for 3 years in a row. To learn more, visit phreesia.com. If you're interested in learning more about Phreesia, you can request a consultation using the drop-down on the right-hand side of your screen or visit phreesia.com. And I'm honored to introduce our panelists who we're so fortunate to have with us today. Patrick Maher is a partner with PwC Strategy and with over 27 years of experience in the US and Europe. He specializes in health systems with clients ranging from top-tier academic medical centers to regional health systems and physician groups. His work focuses on developing long-term enterprise strategies, operating models, consumer strategy and capabilities, and product and service development and prototyping. Inshita Wij is a director with PwC Strategy and's customer transformation practice. She has over 10 years of consulting experience. Inshita focuses on large health system clients with emphasis on delivering consumer experience strategies, workforce strategy, culture, and organization effectiveness engagements. Prior to PwC, she spent 4 years helping hospitality companies with development strategies and feasibility studies. Now it's my pleasure to turn over the presentation to Patrick and Inshita. The floor is yours.
Awesome. Thank you, Adam. Really appreciate the introduction, and we definitely appreciate the time with all of you here today. Let's start with the agenda. What we'd like to do is first talk about the industry evolution towards consumer, and really what does that mean to us in healthcare. Then we'll get into a section where we discuss some of the findings from the consumer research that we've done recently, as well as over the past few years. We'll then talk about the other side of that equation. We want to get into the voice of the caregiver. What are the PCPs and the specialists telling us about their needs in healthcare today? And then finally, for the presentation portion, we'll land on what we see as the top few issues for 2022 that are emergent, and we find that our clients, our customers are thinking about most predominantly as we enter into 2022. And then finally, we'll take Q&A from the audience. So let's start with how we got here and the evolution of the consumer in healthcare. And you'll see on the slide that we've laid out a very, very simple framework that has on the left-hand side of the page, the past, in the middle, present, and over to the right-hand side of the page, the future. We think about this in almost a 1.0, 2.0, 3.0 maturity framework in some ways. Let's start in the past. So what you see at the center of that circle is the figure representing the patient. Around the patient are really the assets, the efficiency, let me go back, the assets and the interactions that the consumer needs to go through in order to activate or engage with the healthcare system. You'll see that the arrows, they're actually pointing from the consumer out. Why is that important? Well, in the past, we put a lot of burden on the consumer to coordinate their care. And a lot of that care was hospital-based. And there were a lot of coordination miscues that patients experienced as they engaged in their healthcare. That was the past. Where are we today? Well, we are focusing as an industry much more on consumer experience, and we're becoming more system-based. What does that mean for the consumer in the middle? It means that we're starting to solve some of those pain points that we created in our past healthcare system. We're beginning to coordinate better. We're beginning to leverage data better. And we're beginning, I think, importantly, to recognize how significant the role of social determinants of health plays in the health and well-being of our patients and our consumers. Where are we headed? I think that's an important discussion and one that we're focused on here today specifically. What we see in the future is a healthcare ecosystem that is acting on behalf of the patients that we serve. Notice that the arrows in the center of that graph now point inward, that as a healthcare industry, we're coordinating our assets, we're coordinating our experiences, and we're driving a much more consistent, coherent relationship with our consumers. What it ultimately means is we're getting much more personalized in our care treatment. We're getting much more coordinated in our interactions with the consumers, and we're really bringing to bear a much more collectively organized system to solve the healthcare needs of our consumers. But I think one of the more important shifts as we think about the future of healthcare and getting to the new consumer-based, consumer-focused future is that we see a shifting notion of our relationship with the consumer. In the past, and even in the present, we still have very much a transactional relationship with them. When we're with them, we're engaged, but when we're not with them, perhaps out of sight, out of mind. But in the future, what we see is that we've shifted our mentality and we start thinking about a lifetime of health and well-being for the consumers that we serve. Notice that there's two aspects to that are quite important in this transformation. One is a notion of lifetime, shifting away from the transactional nature that we have with our patients and our consumers. And then the objective, the second part, health and well-being. We're going much beyond just this notion of sick care that we, are quite adept at treating and solving healthcare issues for our consumers today. But we're really extending that notion to say, what is it about this person, this individual's well-being that affects and impacts their healthcare? And that's important because we're now thinking of our patients in a much more holistic manner than we have in the past. We've gone even beyond the social determinants that impact their health, and we're beginning to think about the relationships that those consumers have with family and friends and how they interact with their overall health and well-being. And we're bringing into this consumer equation a new set of considerations for us, ones that maybe aren't traditional for us to think about, and maybe they aren't directly related to a treatment option, but they do get in the way of this individual's health and well-being, their mental state, their behavioral health, even, their interactions in society. So we see a much more sophisticated future, a much more personalized future for consumers. And that's a trajectory we've seen develop over time. This isn't something new that's come into healthcare in the last few years. In fact, I've been working on this notion of consumer and healthcare for well over 20 years. And we've made significant progress. But I think what we're seeing now is we're seeing a lot more technology come into play that really can enable a much better consumer experience, a much more predictive consumer experience, and one that gets us beyond the in-person treatment of a condition and into this lifetime health and well-being objective that we see consumers wanting and needing in the future. So we have a perspective on how it's developed over time, but let's talk about, on the next slide, what consumer expectations really mean. And if we think about the current healthcare system, what we're seeing is a rapid increase in the expectations that consumers have on us in how we treat them, how we address their healthcare needs. Today, one way in which we think about a framework of expectations of consumers is there's a set of table stakes experiences. Those are expectations, basic expectations that consumers have on us that they're not necessarily willing to pay for, but they take almost as a given. Those are experiences that the consumer says, this is a minimum for you to engage with me. There's differentiated experiences. Those are the next level of sophistication, ones where we actually maybe surprise and delight our consumers. We give them something that maybe they didn't expect. Probably it's a better coordination, it's a better interaction, but it's something that pleases them in a better way. Finally, we see leading edge experiences where, as I talked about, we're seeing technology come into this relationship with the consumer. And we're seeing it being used, I think, most importantly in today's environment, in a better way that creates a much tighter connection with the consumer, but it enables the care teams that we have on the ground that are interfacing with our consumers. It enables them to spend more time with their consumers, to know them better, to engage with them better, and much more efficiently. And we're seeing that some of the leading healthcare systems that we work with across the country, they are beginning to dip their toe into this notion of lifetime of health and well-being and designing products and services that are taking us far beyond just the treatment in the clinical setting to this notion of how do I get upstream and help the consumer with their healthcare concerns and considerations before they need to engage us, and then how do we stay with them after we've treated them? How do we get them back onto this path of well-being, get them to their health objectives and where they really wanted to be before they got sick and before they needed to engage with healthcare? And so we're starting to see more stickiness being created through this recognition that the consumer relationship, the healthcare needs that they have, isn't necessarily a moment in time, but rather it's a journey to be solved. And I think that's where we're beginning to see a lot of really innovative thinking, both from new entrants and from traditional players in the industry, as they begin to think about how they create a more sticky, a more consumer-centric, relationship-focused future. So that's our perspective on, one, how the industry has evolved over time and where it's headed, as well as a way of thinking about the consumer experiences. They're constantly changing, they're constantly maturing, and they're constantly evolving. So let's maybe switch gears for a moment, and I'll hand it over to Inshita. And I know, Inshita, you've done a lot of research with consumers, both recently, and I know together we've done research with consumers over time. So let's talk about what we're finding that consumers are really telling us. What are they screaming for today?
Yeah, thanks, Patrick. We did undertake a survey of about 1,500 healthcare consumers across the US last year. And really the thought process behind the survey was, we are in very uncertain times, right, that we have not seen before. What is really the change in consumer behavior in this period and pandemic, and hone into how people are thinking about healthcare choices now? What are those expectations and how have they enhanced? We also just wanted to have very rich data about choices, but also desires, right? So what is it really that consumers need? What do they want? and what are they expecting from healthcare going forward? And you know this, but we've been getting questions from our healthcare clients on what actions or strategies should they undertake to really attract and retain those consumers. And this survey helps outline some of the ways that our healthcare clients can do that and maximize their investments in the consumer experience space. So as you see on the page, we made sure that we have diverse responses, very representative of the US population in terms of demographics, in terms of health status, and also types of health plans or insurance that people have. So with that context, let's dive into some key insights and actually learn about what our consumers had to say. So let's start with what I found to be perhaps the most alarming when I looked at the data, that despite so many new products and offerings by healthcare organizations and new entrants, consumers are not satisfied with managing very critical basic aspects of their health and wellness. They still need a lot of help. As you see on this page, about 50% or half of the consumers are not satisfied with their ability to manage weight and exercise. And more than 40% of consumers are not satisfied with their ability to manage chronic illness, manage diet, stress, and even sleep.
Inshita, you know where I'm going to go with this, I think, because we talk about segments all the time, and we talk about deepening our understanding of the consumers that we serve. And they're not just one block. So as we surveyed them, and as you dig deeper into the different segments, do you find any, interesting factors that become more alarming or less alarming? Do you see any key differences across consumer segments?
Yeah, thanks for bringing that up. And as we dive into the data, we do see that respondents who identify as females have serious chronic illnesses or low household income respondents indicate the largest dissatisfaction in managing their health. And this emphasizes, right, that the focus on health equity and population health that as an industry we've been having a conversation about for a while is still a very large need. And there is still a gap for that true health partner in care who's not only treating sickness, but engaging in consumers to manage their overall wellness. So let's go to the next finding. And this was also surprising to me that compared to some of the other industries where we have worked, we see that healthcare consumers have very low loyalty to their providers. Even among consumers who indicated that they were satisfied with their current providers, half of them said they'd be willing to switch. This tells us that consumers are looking for alternative choices and they are expecting more from their healthcare experience, going back to what Patrick said in terms of evolving consumer expectations. And I think from a healthcare provider lens and as an industry, we need to think about how are we measuring satisfaction and loyalty?
So, interesting question here, and we see this in other industries where younger consumers we found tend to be less loyal. They tend to switch more often. And, I'm just curious, do we see any loyalty differences between, the demographic groups of the consumers that we're serving, younger versus older, et cetera?
Yeah, and that instinct that I'm guessing a lot of our audience might have as well is very spot on, right? So younger consumers are less loyal. 51% of respondents in the age group, as we saw in the survey, of 18 to 54, show willingness to switch as high as 51%, whereas 26% only of 55 years and over say that they're willing to switch. And these 2 points are correlated, right? So healthier population is also more likely to switch, and we know that younger population does in general tend to be healthier, and they're more likely to switch than people with chronic and life-threatening conditions. So I think this also leads us into a conversation about how can we use more digital and virtual tools to engage more of these populations, especially I know a lot of our audience is interested in targeting these consumers as well. So I think a lot of healthcare organizations today are wondering if the virtual or telehealth usage is here to stay, or if they should invest more in expanding these services. So from the survey, the short answer is yes. The demand for virtual care exists and persists, and it remains unmet. There are a few data points from our survey that support this pretty clearly. So firstly, it was the third most used channel, and more than half of the consumers did use virtual care in the past year, which I'm sure is not surprising to anyone hearing this. But for more context, 50% of people used virtual care, but only 35% used alternative channels like urgent care and retail. So it is definitely a more popular channel, and we're seeing that people are using it more for follow-up care and for non-urgent care as well. And also the frequency of usage, right? So consumers who used virtual care used it more than 4 times a year, which tells us that there is definitely a very kind of growing comfort with the channel. And then also want to highlight that people who used it liked the experience and want to continue using it in the future. So 90% of the consumers are satisfied or highly satisfied with the virtual providers. And the majority of consumers who had a virtual visit want to maintain or increase their usage. And lastly, what we've also noticed in the data, not only from this consumer survey, but as we've been doing this research over the years, is that consumers are becoming a lot more trusting of digital medical advice. So consumers rated healthcare apps and internet only second to medical experts in terms of how they would get medical help.
So let's maybe bring this back a second to the consumer expectation framework that we shared earlier. I think one thing that sticks out to me is that pre-pandemic, consumers thought of virtual care as a differentiated experience. Out of necessity and the need to actually continue to deliver care and do it virtually in sort of the subsequent waves of COVID that have come through and really, disrupted healthcare delivery over the last couple of years, and the rapid adoption that consumers have had, in their experiences with virtual health, we're now seeing it actually as a must-have. It's not really differentiated any longer. It's now become a base expectations that consumers bring to the table when they engage with any healthcare provider. They want to have that channel open to them. They want to be able to engage with their clinical team virtually. I think that's an important shift that's happened in the last 2 years.
Exactly. And you're totally right in saying that healthcare consumers not only want to engage more through digital channels, but they really are looking for that convenience, right? So even alternative channels that offer more convenience. And we really want to meet consumers where they are as we go forward. So if we flip to the next page, the survey shows us that in the past year, over 30% of consumers received care more than 3 times at these alternative sites of care. So your fitness centers, your retail clinics, workplace, alternative clinic, or at home. And more than 40% of consumers who use these alternative sites want to increase utilization. So what that means for us as an industry is developing that broad ecosystem of care through partnerships, through alliances with emerging players to really thrive in this environment where everyone from consumer goods companies to tech organizations are now competing for that healthcare dollar or share of wallet for our consumers. And there are several advantages of taking this ecosystem approach, if you will. You start to obtain a lot of data about your consumers, and not only healthcare data, but data about their preferences, their lifestyles. So you really get to know your consumers and gain their trust. And you're also getting more access to a broader consumer base that you might not have through these partnerships and building that kind of end-to-end continuum for your consumers. So Patrick, you also said that this is fast becoming a must-have. And I want to elaborate on that point as well with this page. So we asked our consumers kind of what services you want going forward from healthcare and how much are you willing to pay for them. And it was very interesting. So you see this lower quadrant on the page. This is where people said, yes, we really want these services and we're like maximum in their top 3. But they also said we're not willing to pay for it anymore because it's very table stakes or basics. So things like price comparison tools, digitally consolidated health information, and a single location where you can do your appointments and labs. People are saying, we've looked for this from healthcare for a very long time. Other industries are delivering a digital experience so seamlessly, so it's kind of high time that healthcare got there. And Patrick, I'm sure even you're seeing this in your day-to-day work.
Oh, absolutely. And I think we're seeing this notion of the ever increasing consumer expectations around convenience really, start to play its way into the industry. And the funny thing or interesting thing to me is that consumers are bringing these expectations not necessarily from their day-to-day interactions with healthcare, but their day-to-day interactions with any industry, any situation that they're in. And they're starting to expect the same sort of conveniences, the same sort of interaction, the same sort of knowledge about my relationship with you, right, that they see with other industries, and they're bringing that into healthcare.
Exactly.
And we tend to see that healthcare is responding. They're starting to do things that were years ago unheard of, focusing on implementing CRM systems, for example, right? Something that goes well beyond the medical record and into what's our relationship with the consumer. They're getting much more focused on smoothing out some of these bumps and inconsistencies in the data flows in their own organization, right? And they're getting better about those connection points that they have with consumers and making them more seamless, more integrated, but I think more importantly, more consistent, right? A little less discrepancy in one view versus another. They're trying to really get to a single point of view around the consumer that they're serving, the needs that they have, and how can their organization activate their resources for the sake of that individual. Now, one of the things you touched on, Inshita, is, beyond this must-have notion that we have, the rising expectations of consumers, you have done research on what it takes to differentiate for consumers, right? What are the features? What are the services that consumers would be willing to pay for, right? What goes above and beyond their expectations, and what would consumers really be willing to pay for when it comes to healthcare? Can you shed some light on that?
For sure. And I think sometimes we're kind of in the industry a roadblock for ourselves when we say that, oh, we can't build these additional services because we think consumers are not going to pay for it. But we do see that there is a need for personalization and on-demand access. And what consumers are telling us is, yes, we care about that and we are willing to pay if these services are offered well in an integrated way. So for example, consumers are willing to pay $400 to $600 annually for services such as managing care for aging family members and integrated family planning services from fertility all the way through getting your child's annual visits when they're an infant. So I guess the best way that we've seen our clients capture some of this is in 3 ways. Improving the consumer experience, which is existing in their services through new tools, partnerships, or alliances. So really expanding your existing pie, if you will. Adding adjacent health and wellness offerings, such as health coaching, caregiver services to capture more of those consumer dollars. and also getting smarter about consumers they serve and targeting consumers that really they can win with. So there are specific services that consumers are willing to pay for, but we need to get sharper on it and really make sure that we're building loyalty through these services.
That makes sense.
Patrick? Yeah, would you like to talk about how this sort of consumer voice and expectations really line up with the needs of the physicians and care teams as well?
Absolutely. So there are two sides to this coin. On one side, we've got the voice of the consumer and what are they seeking, and on the other side, we have the voice of our care teams and what are the services, what are the solutions that they're seeking that ultimately will enable them to serve the patients, to serve the consumers better. And so here's what we're seeing in the marketplace. We've done a lot of research over the years with both primary care physicians and specialists. And we see that, by and large, both PCPs and specialists are truly seeking solutions that make their day-to-day work life much easier, that enable them to spend more time with the patients that they serve, to effectively act at the top of their license that we've talked in the industry much about for many years. And they really truly want to address the needs and expectations of their consumers. But let's start with the specialists here and reflect on high demand services that they seek. And for the most part, specialists are focused on making their work more efficient and integrating more effectively in an ever increasingly connected healthcare environment. What does that really mean? It means that specialists are the individuals that we refer patients to, right? And we need to make sure that that connection between the PCP and the specialist is as seamless as possible. And we need to make the work that they do, the services that they provide for their patients, as efficient as possible. Because that connection point between the consumer and the specialist is an all-important one. We know that the patient at that point needs pretty significant care, and rather than burden the specialist with a lot of administrative functions, we really want them to spend the time with their patients that they're serving. And that's reflected in what we're hearing from our specialists. You'll see that billing and coding, virtual care EMR integration, payment and collections, the whole financial counseling aspect of working with their patients is important. The financing aspect, contract negotiations so that they're in network, for example, the budgeting that they need to do to manage the financial position of their practice are important. And then finally, quality and regulatory management. These are all things that are administratively complex to deal with. And quite honestly, specialists tend to not have as many resources as, say, larger organizations to handle these things. And so we see a lot of focus that specialists have on really getting administratively efficient. Let's take a look at what PCPs are saying to us. And I think they're saying something similar, that on one hand, they want to be as administratively efficient as possible. You see the same things like billing and coding on here, virtual EMR integration, for example, payment and collections as being very important to them, similar to the specialists. But what I think you also find is that the PCP, being largely on the front line of that relationship with their patients, you see a couple of other things bubble up to the top and become quite important for PCPs, particularly patient-facing sort of capabilities, right? How do they make that day-to-day interaction with the patient much more seamless, much more simple, less paper-based, more automated, more technology-driven, right? Less phone and fax-driven, right? They really are looking for a much more seamless introduction of the patient into their practice. Much like you see when you walk into a retail store these days, that interaction that you're having with those retailers is, well, honestly, much more digitized and much more efficient. We're also seeing, as you would expect, e-visit, telemedicine platform solutions is becoming or being more important. Not surprising, given the past couple of years that we've been through. But I don't think, at least in the research that we've done with PCPs and some of our day-to-day work with our clients, there's still some pain points that physicians are dealing with as it relates to some of those platforms, right? They really need it to be as seamless as possible, as reliable as possible, and then not create those sort of technical hiccups that often occur in our increasingly virtual world in which we serve our patients.
Yeah, exactly. So I think what we're hearing is what consumers want is really where the physicians are asking for help for as well. And
Indeed.
Patrick, would you also like to talk about, as we take a step back, what are some of the issues that face our industry and what should we be thinking about as we go about this very unexpected 2022?
Thanks, Inshita. That sounds like quite a challenge. The issues facing hospital systems and physician groups are certainly abundant, if not overwhelming at times. And if we were to lay them all out, we would be here pretty much all day discussing them. But what I want to focus on is what we're hearing from our clients, what we're hearing from our hospital systems and physician groups as being, very pressing issues in the near term, right? Stepping maybe back from the longer term strategic things that we've been talking about, what do we see coming down the pipeline here in the near term that are important and pressing as we go into 2022? And it's a 2022 we hope will be much more normal, but as we've learned over the last few years, hopes can be inspirational, but we have to be pragmatic as well. So what does it mean as we think about the issues facing our physician groups and hospital systems? One is that as consultants, we tend to think about our clients and our systems and our industry in this balance of supply and demand. And we actually have issues that are affecting both the supply side of the equation and the demand side of the equation as we go into 2022. If we think about demand first, there's still a lot of volume volatility. Of course, various reasons for that. We'll get into it into a moment. But when you couple that with some anticipated changes in reimbursement, we think that there's some significant revenue instability that healthcare organizations are going to have to deal with quite quickly as we get into 2022. And then from the supply side, we all experience this and we know it well, that there are significant workforce challenges as we go into this new year and as we continue to deal with the effects of the pandemic. If we go to the next slide here for 1 second, I want to talk about reimbursement for a moment. And this is important, obviously, for physician groups and hospital systems alike. But there's a couple of issues here that are pretty big and bold and could have some significant implications for those in the industry as we think about 2022. First is the Medicare physician fee schedule proposed cuts that come into effect, or are supposed to come into effect April 2022. Now, what is the implication of that? Well, of course, we're going to have practices that are going to have to deal with revenue gaps, right? There's now going to be potentially revenue reduction that they're going to have to potentially make up for. How can they deal with this? Number of ways. They can get sharper and smarter about targeting the consumers that they serve. So focusing on where they can meet and deliver on their consumer needs in a much better way and a much more efficient way. They can focus on operational efficiency. How do you do that? You leverage a lot more technology than we have in the past. You look for real plug and play digital solutions that'll help you as a practice become much more efficient. And you could also offer new products and services to consumers, much like you discussed earlier, Inshita, around what consumers are willing to pay for. We can begin to investigate our opportunities in our delivery of healthcare, of getting into some of those things that consumers are willing to pay for. Maybe not directly, but even if we can coordinate some of those activities on behalf of patients, we might be able to make up for some of that lost revenue. So that's one key issue, and I think it'll become quite important as we get a little further into 2022. Secondly, let's go back to the slide for a second. Secondly, and I think interestingly, it isn't discussed as much as I would expect yet, but will be, I think, as we get further into the year, and that's the No Surprises Act and the penalties that are involved when we sort of shock and awe our consumers and our patients by, delivering them bills that they didn't expect. And operationally, this is going to be a pretty big challenge for both physician groups and hospital systems alike. Hospital systems in particular deal with physicians that are both in network and out of network. Sometimes they're tightly aligned, sometimes they're loosely aligned, sometimes they're not aligned at all. And the surprise billing burden that it places on organizations is going to be pretty significant. So I think that's one key issue. The other there is that this could become a real frustration point for consumers, at least in the near term, because as I think about what it's going to take to inform your consumer, your patient, in a way that you won't surprise them, I have this vision of us drowning them with legalese and clauses and considerations that, our patients just aren't willing to wade through, and two, don't necessarily provide the clarity and simplicity that we're hearing consumers and patients are asking for. So I think those are big issues to deal with in 2022. If we go to the next slide, let's talk about this volatility of volume issue that we've experienced over the last couple of years as COVID has come in and out of our environment, and the impact that it's had on hospital systems and physician groups. What we see is just radical, significant shifts in demand, up, down, up, down. We see that patients, consumers have, in many cases, delayed care, and that's caused significant issues down the line. And we expect that the demand is going to continue to fluctuate. Obviously, Omicron is working its way across the country currently, and that's causing a lot of disruption. And it wouldn't surprise me if we see subsequent waves of disruption as we go forward. But the implication here for our clients is well, it's pretty clear. One, we've got to do a better job of leveraging predictive analytics and forecasting demand. We need to try and get ahead of the curve so that we can flex up or flex down as we see the needs of our patients moving from one setting to another. And that's, I think there are a lot of tools that can be leveraged, but it's an important one as an industry that we need to get better at. Second is, obviously we're going to need to invest significantly more in digital tools that streamline communication across channels and enable better interactions with our patients when we are in those situations where we just can't see them face to face, right? We're going to have to make that experience digitally as impactful as we see when we're in a face-to-face interaction. And then finally, cost structures. This is always a difficult one for organizations, but we're going to have to learn to adapt to fluctuations in demand, as well as fluctuations in our staff that we see over time. And we're going to have to create some real flexibility in our delivery here. We're going to have to rapidly become more efficient, rapidly become more effective. We're going to have to cut costs where we can. We're going to have to variabilize as many costs as we can so that we can create the kind of agility that we need in the organizations and resilience, to be quite honest. Finally, and I think maybe most importantly, I'd like to get to the workforce challenges because our care teams have suffered tremendously. They've had an enormous amount to deal with over the last couple of years. And if we look at the impact that it's having, well, there are a few key aspects that jump out to me. First is, of course, the cost of our resources has jumped significantly recently, and we're going to have to learn how to cope with that in our organizations. Not going to be easy, but we're going to have to cope with it by building in better ways of working, by building in more process automation, right? By leveraging better technologies so that we can get greater efficiencies out of the resources that we do have. Secondly, there's a shortage, and it's not, as we have here on the page, it's not just about nurses. We just have shortages across the board in healthcare, and we're going to have to cope with that in the near term as best possible. It's difficult in these times because of COVID volatility, but I think in the long run, we're going to have to confront this long-term shortage by ever increasing leverage of technology and better enabling our care teams to serve even more people or patients in a much better way. But lastly, I'd like to focus on the behavioral health aspects of our care teams. And Inshita and I, some time ago, almost at the beginning of the pandemic, started thinking about the behavioral health implications of coping through very trying times. And the mental health issues that are placed on our care teams are extraordinary. They're coping with depression, they're coping with anxiety, and they're seeing patients really go through some very, very difficult times, and that's taking a toll on the care teams. And we're seeing the impact of that in terms of whether that's individuals leaving the industry altogether. We're seeing it in absenteeism or needing more time off to recover. And fortunately, and I think thankfully, we're also seeing that the healthcare systems and physician groups that we work with are really beginning to respond. They're beginning to respond by focusing much more on employee well-being. They're doing their level best to reduce the administrative burden that we placed on those team members. And here's where I think it begins to get really interesting, is they're beginning to think about this notion of digitally upskilling those care team practitioners and thinking about ways in which they can leverage new technologies to not only make their jobs more efficient, but to actually make them much more rewarding, much more valuable, and to create that kind of connective tissue that they need to have with the patients and consumers that they're serving. Those are some of the things that we're seeing. There's, like I said, many more that we could get into, but those are certainly the top issues. Adam, I'm quite certain we've got Q&A coming in, or certainly questions coming in. So let's jump over to questions.
Well, we do. And I just have to say, wow. I mean, I've been following this survey for some time, in the past years you've had it. And this is such a pivotal year for this particular survey. So thank you so much for such an insightful presentation. I'm thrilled to share some of the questions we're getting. Audience, please keep sending in questions. We'll get to as many as we have time for. And if we don't get to your question, we'll make sure to follow up with you if we can. So I want to start backing up a second, talking about a topic that's come up a lot in your presentation, and that's patient loyalty and stickiness. I'm wondering what advice you have for health systems who are trying to build more patient loyalty, which is something we talk about at Phreesia a lot. How do you do that? How do you implement that, and how can technology play a role? Inshita, do you want to start?
Yeah, definitely. So I think two things come to mind as you ask. So one is just as a healthcare industry, we need to get better at just measuring the metrics and understanding loyalty. I think right now we're getting a lot of lagging data, but we can start to use even some of the basics that other industries are doing. So net promoter scores, ease of use at specific steps, what is that brand awareness and connection? So first step is just like understanding where we are building that relationship with the consumer or where we're losing them. And then the second is building that ecosystem, right? So in the survey, we talked about expanding partnerships and really going to consumers as an expanded offering. So not only just a hospital, but the virtual, the alternative locations. And with that ecosystem, creating that integrated experiences. And that integrated experience is really what creates loyalty. So if you think about Apple, right, your iPhone connects to your MacBook, connects to other Apple devices. So that's like one example of an ecosystem outside of healthcare, but that's really what creates that stickiness.
Patrick, anything to add?
Yeah, I think that it's important that in order to create stickiness and in order to create loyalty, that we get much more in-depth insight into the consumers that we're serving. Over the years, we've seen that we've learned a lot about our consumers in the way in which they engage with us transactionally in the hospital or in the physician office. But what we don't have is a lot of insight about really who they are in the environment that they live in, the challenges that they're dealing with. And I think that, if I were to, encourage us to take a step forward, I would say, let's move beyond the data that we already know and build in those additional data sets that'll give us a much more granular insight into the consumers that we're serving, but also not to view those consumers as one broad lump of consumers. We really need to get sharper about segmenting different consumer sets and understanding what creates stickiness and loyalty for those.
I know one of the things sorry, go ahead.
Finally, I just wanted to say that even when we have the data, we as a health system, as hospital systems and physician groups, we need to think much more expansively about this journey that they're on, that the consumer was on a journey that was probably quite difficult for them before they ever called us or engaged with us. And they have a difficult recovery once we're done helping them out with whatever condition or situation that they're dealing with. And we need to recognize that we're a moment in time of a larger consumer journey. I think that's important.
I absolutely agree. And I think one of the things I know we talk about here a lot is making sure we have that data from consumers on who they are, whether it's race, ethnicity, socioeconomic, factors, and language too is a really important one. So I couldn't agree more. So one of the things I found really interesting was when you talked about traditional versus alternative channels of care. And we know the traditional healthcare, whether it's hospitals, ambulatory sites, they are still boasting higher utilization. But I was surprised by the stickiness of some of these alternative channels, fitness centers, retail clinics, office clinics, where 30% of patients visited more than 3 times. And I think that's interesting because it's uncommon for you to see the same physician at these types of locations every time. Do you think we've shifted, Patrick, from being loyal to a specific clinician to being loyal to an organization or a location? Because that has a lot of implications for the experience we're providing.
Well, it's a great question. I don't know that the research is really saying that I'm loyal to a location versus a physician. It's rather saying, at least to me, it's saying that consumers are loyal to their convenience. And recall, Adam, in the introduction when we talked about healthcare 1.0, the burden was significantly on the consumer to coordinate every aspect of their healthcare. And still, even in today's world, they're coordinating as many of those aspects as they can. The getting your care delivered is one thing, engaging with your health plan is an entirely different thing for many of us, and it's still a burden. And so what we're seeing is that consumers are really focusing and leveraging as much as they can around the convenience aspect of getting care, right? They're just seeking out convenience and efficiency. And we still have a long way to go, to be honest.
Fantastic. We've got just about 5 to 10 minutes left. I want to get to a question we've got on around kind of two of the must-have services, I should say, that were talked about in the presentation, were the idea that health information is consolidated digitally, and then B, that people would like to go to one location for their appointments and labs. And there's plenty of examples where physically we see that, but I'm wondering if, where primary care, specialty care, labs, they're in the same place, sometimes pharmacy too, but I'm wondering if we're getting that digital experience right. I know, for example, I go to my primary care and I go to the lab and I have to check in another time and they don't know I'm coming, and because I don't have an appointment with the lab. Are we getting that right? And as we partner between organizations, like where do you see us a need to consolidate that check-in experience and kind of mold all that together? Inshita?
Yeah, I think some of that digital integration, consumers are getting this in other industries, right? With their retail shopping, they're able to see their cart, their spending, manage returns. Whereas with healthcare, this digital experience is still pretty fragmented. If I went to the doctor yesterday, or if I saw 2 different physicians, I can't really log in and see the notes from those visits, or know exactly, like if I missed some conversation because I was under medication, there's no way for me to kind of go back and reference it. And even if I want to take my records to the next physician, there's a number of steps involved in doing that. And that isn't really that seamless integrated experience that sometimes we overpromise on in a way. So I still think that there is a ways to go as an industry to make this a lot more seamless and frictionless, not just on what I'll call some of the admin aspects, if you will, like getting your appointment, seeing the appointment, scheduling, but also integrating that with the clinical aspects, right? Can I talk to my, nurse that I saw yesterday if I have a quick question on the medication, and can I do that seamlessly in one place?
Fantastic.
So, Adam, I'd like to actually add a little something to that, because a lot of us in this industry and that work with this industry are here because we're motivated by a lot of personal experiences, right? Most of the time quite painful. And I was actually talking with a family member the other day about this notion of, check-in, right? And he brought it up. It's actually my father. So he brought it up because he had an issue to deal with and was in one hospital system, moving from department to department. As he moved through each department, there was a new process of checking in, right? It had to be done, and redone multiple times. And it's like check-in Groundhog Day when we engage with our providers. And that just makes no sense, to be honest. And it creates a lot of, frustration on behalf of the patient.
Yeah, I think as we're seeing ambulatory increasingly being folded into health systems, it's a topic that I know that Phreesia we're absolutely paid attention to, and I'm sure you are as well, as folks try to consolidate and streamline that experience. So great points from both of you. Thank you so much. We're out of time for today. I want to sincerely thank both Patrick and Inshita for an engaging and informative presentation. Again, audience, if you have questions for us here at Phreesia, you can request a consultation using the form on your screen. Thank you so much for joining us today. Thanks, Patrick and Inshita.
Thank you much,
thanks
everyone.
for having us.
Keep up the great work.
Thank you.